So finally, a forward-looking question. The role of AI, artificial intelligence, and transforming traditional ultrasound use and its interpretation in critical care. What is the potential of AI to enhance image analysis in diagnostic accuracy and support clinical decision making? And what could it mean for the future of ultrasound in ICU?
A very relevant question, particularly looking ahead at the future. In fact, I understand there are many machines, I haven't used any of them, that do use AI tools to help assist you with image capture as well as the interpretation of images with ultrasonography and echocardiography. Some of the newer machines do allow that. As I mentioned, I have no experience with those machines. But the future, of course, lies in data analysis, deep learning, machine learning, and big data. Now that's where the future lies, not only in the field of ultrasonography, but with general data capture in intensive care medicine. Like, for instance, if you look at the monitoring trends over time, it has been shown to give you a very good, very precise indication as to which way your patients are heading, which may escape even the most astute clinician by the bedside, simply because we do not have the capability to analyze so much of data in our heads. That's where machine learning, machine analysis would help in a big way. And particularly in terms of the use of echocardiography, there are several tools that have been already employed by some of the new machines in helping you with, as I mentioned, velocity time integral is an important parameter that you go by. Smart VTI and auto VTI, which is automatic measurement of the stroke volume. Once you get a 5-chamber view and once you get Doppler, you don't have to do any calculation. It'll automatically trace a waveform, which even the older machines do. Not only would it trace a waveform, but it'll also give you the VTI straight away without you having to indulge in any calculations in your head. So that is actually, and the cardiac out and the stroke volume as well as a direct measurement. So that will be a very useful tool and can guide you as to whether your probe positioning is appropriate and whether your measurements are dependable or not. So that is good feedback to have as well if you have artificial intelligence at your disposal. And there are several machines which help with, I understand, one-click VTI. If you get the apical 4-chamber view, just by the click of a button, you will get the velocity time integral. So that is indeed extremely useful if you can get a handle on one of those machines. We talked about ejection fraction and eyeballing and the time that it might take for precise measurement of the ventricular dimensions to get a precise measurement of the ejection fraction. All that may be a thing of the past because auto measurements may be possible. It's possible even now. In systole and diastole, you don't need to manually outline the ventricle. It will do it for you in an automated fashion and give you a precise estimate of the ejection fraction, which will go a long way in saving time and also help you with precision measurement of the ejection fraction. Auto assessment of the IVC diameter and its variability in terms of the distensibility index and the collapsibility index, these might also become automated with the newer machines. You won't have to go through multiple steps as in freezing the image, measurement at the maximal and the minimal diameter, and then do your calculation. All those things are going to be a thing of the past. It'll all do it in an automated fashion for you. The other area where artificial intelligence may be of great use is in the assessment of B lines. There is software called Smart B-line assessment, Auto B-line assessment, which helps to count the number of B lines per image, measure the distance between them. So that will give you an indication as to how bad the lungs are, particularly say in ARDS or cardiogenic pulmonary edema. How many B lines, distance between the B lines, are they coalescent or are they discrete? So that will tell you how severe the degree of involvement of the lung is. The other important area of interest with artificial intelligence is to look at the gastric content. We are all worried about patients fasting before major surgical procedures and for other things as well. And automated measurement of the gastric content might again enable you to tell if your patient is adequately fasted in terms of looking at gastric motility, if there is any gastroparesis. So all these things may also be feasible with the use of automated ultrasonography. So it's as in other areas of medical care, AI will play a major role in the future to help us handle ICU, critical situations in the ICU, to diagnose problems, assess progress of our patients with greater precision than we can do on our own, using our own calculations by the bedside.
Thank you, sir. Thank you for beautifully summarizing the role of artificial intelligence, and is something which is quite interesting and something to look forward to in future.
Thank you, Monalisa.
So to conclude, a huge thank you to Dr. Chacko for sharing his expertise and practical tips. I am fortunate to see him using ultrasound as one of his most important clinical tools in daily decision making. His vast experience and thoughtful perspectives reminds us of the importance of using ultrasound, the fifth pillar of a clinical examination, in making informed, patient-centered decisions in critical care. Thank you once again. Stay tuned.
Thank you, Jaicob. Thanks, Monalisa. Till we meet next time.
Thank you for joining us, sir.